Morgan Stebbins. I'm a PN student at Wilson State College, and today I'll be performing how to insert an indwelling catheter and how to be removing an indwelling catheter. Now, before I can even go into my patient's room, I'm going to have to check my healthcare provider's orders. So I have it right here, and on this it says that I have my patient is Shirley Cost. She's a 33-year-old female. Her date of birth is 4/3/1987. She doesn't have any allergies to latex or benzocaine, and I'll make sure to ask her again when I go in the room. And it says for 10:15 to insert an indwelling catheter. So, okay, I have 10:15. So right now it's about 10 o'clock, so that's perfect. We're within time. So I'll be able to insert that. And then also I've went in beforehand to check on Shirley, make sure she knows the procedure, everything like that. My CNA's already went in the room beforehand and done peri-cares on Shirley. And then I went in and assessed Shirley afterwards, and she'll be needing a 14 French catheter. So that's what I have right here, my supplies. So I have that. And so my CNA did peri-cares, and so now I'll be able to go into the room, and then I'm gonna talk over the procedure with Shirley, and then I'm gonna start with my catheter insertion. So we can go into the room. Hi Shirley, how are you? Doing okay? Well, my name is Morgan. I'm your student today. Can I just have you verify your name and date of birth, please? Shirley Coast. Okay, perfect. Date of birth 4/3/1987. Perfect. And I'm just gonna check your wristband. Do you have any allergies? Okay, you do. Okay, you don't have any allergies. Okay, perfect. So I was just making sure that you don't have any latex allergies, and your date of birth and name match up, so that's good. Do you know what we're doing today? Yes, we're gonna insert a catheter. Do you know why you need a catheter inserted? Kind of? Okay, well, I'm just gonna tell you. So we're inserting a catheter because you're just having a little bit of problem urinating on your own. So we're just gonna insert that up. It's just gonna be a couple inches in your urethra. So yeah, we're gonna insert that, and then we're gonna get an intake on like how much urine you're outputting and everything like that. Okay, does that sound okay? Okay, do you have any questions for me? Not right now? Okay, Shirley. So if you don't have any questions for me, I'm just gonna place that there. And then I'm just gonna come over, and first I'm gonna raise the bed up to a good height, Shirley, just so I can get a good, comfortable height. Okay, perfect, Shirley. Now, are you doing okay? You are. Okay. Perfect. I'm just gonna set this down so I have better access to you. Okay, Shirley? Okay. So I'm gonna perform my hand hygiene again. And then I've already assessed you, Shirley, for your size of your catheter. So I'm just gonna be bringing this blanket up so you can still have some privacy and you're still warm when we do this, because it can get quite cold. Okay? And then I'm gonna put your legs in a dorsal recumbent position. Okay, perfect. So here we go, Shirley. Sorry, didn't mean to touch that. Okay, so I'm gonna do hand hygiene. Okay, Shirley, so now I'm gonna start the procedure, okay? Okay. So I'm gonna open up my container, and I'm gonna remove everything I will not be using. Okay. And then now I'll be taking away. From the sides. Okay. And then I'm just gonna hold these to get a nice firm so they stay down. And then I'm gonna grab my gloves. Okay. Okay, perfect. So I'm first going to be putting on my right glove with my non-dominant hand. So just the inside, perfect. And then now put my other glove on. I'm going to make sure to get these gloves on right so that they're on well for my procedure. Okay, now that I have that on, now I can place that, and I would have just dropped that from above. And then I'm going to be grabbing this, and then opening this up. And then with shiny side down, I'm going to be placing this down. And then I can move this how I need to. And then I would have like Shirley scoot up her butt or anything so I can get this underneath. But for demo purposes, I'll just leave it right there. And then this is my fenestrated drape. So I'm going to just drop that in the garbage. And then I'm going to only be needing one of these. So I'm just going to drop this in the garbage as well. And then I'll just be needing these. So I'm going to tear off my swab sticks. There we go. Dropping that in the garbage. I'm going to be shimmying these up. I'm going to be discarding this. And then I'm going to be grabbing my lube. If I can grab it, there we go. Okay, perfect. So I got my lube, and I'm just going to open this up. Now for this demo, I'm just going to be squirting in here so you guys know that. I know that I would use this lube in real life, but for this demo, I'm just going to be using the spray before I insert. So now that I have that, now I'm going to place this over here, and then I'm going to just be grabbing this because I won't need it, placing it in the trash. And then I'm just going to be grabbing this. And so we're going to be taking off this. So we're going to be placing that back down. Okay, and then I can just drop this. And then after that, I'm just going to move my box. Okay, perfect. So I'm going to move my box, and then I'm going to grab my syringe. And for this demo, I'm only going to be using 5 milliliters. Dropping that. So put that there. And then I'm just going to be turning my box. Still making sure not to get within the 1-inch margin. Okay. So now that that's done, I'm gonna be now cleaning Shirley and cleaning her labia. So now I'm gonna be placing my hand. So that hand has to stay like that the whole time. And then I'm gonna be grabbing my swabs, and I'm gonna be swiping away from me. One swipe down, drop. Swiping down again, drop, and then all the way down once through the meatus. And now that I'm done with that, I should have beforehand connected my syringe, so that's what I'm going to be doing. There we go. Okay. So I should have done that beforehand, but I did that now. So now I'm going to be having my partner lubricate 3 to 4 inches. And here, I'll place it down so it might be easier. Thank you. And now, Shirley, I'm going to have you, when I insert, pretend like you're blowing through a straw or kind of bear down for me, okay? Okay, sounds good, Shirley. So ready? 1, 2, 3. So I'm going to insert about 2 to 3 inches, and then I see some urine return, so I'm going to insert about 1 inch more. And then once I have that there, then I can move my hand from her labia over here. Oh. This is why it's important, unlike I did, to insert it beforehand so you make sure it gets on. Okay. Okay, so now it's on, so now I can insert my 5 mils. So, and then after I would have inserted my 5 mils, I would have had this on like this, and I did insert my 5 mils. I just think that it came off. So I would have undid this, placed it over here. I did give this a little tug so I know the balloon's in there securely. And so now I'm able to take this, holding this secure, and grab this, and then take some tape, place it on Shirley's inner thigh. Okay, so I got this secure. So now I'm able to put this on a non-movable place on the bed. So I'm going to place it right under here. And my mess wouldn't be there, it would actually go in the trash. And then I'd make sure Shirley's doing okay. And then I'd put everything inside here. And then I would grab my materials. And then I take off my gloves, perform hand hygiene, and then help Shirley put her legs back down. And then now I'll take off my gloves. So I'm gonna take them off, throw them away. I do hand hygiene, put Shirley's rail up. Okay, perfect, Shirley. How are you doing? You're doing okay? So I'm gonna have the CNA come in and do pericares just to get some of that betadine off and make sure you're comfortable and you feel clean, okay? Okay, so I'm gonna leave your collar right here. I'd lower the bed down. I'd make sure Shirley is comfortable. And I'd also make sure to document and to document how Shirley tolerated the procedure, how it went, how she performed, everything like that. And then I'd be able to leave the room. So I'm leaving the room, and then magically, it's a couple days later, and Shirley needs to have her catheter removed. So here I have my doctor's orders, and I have Shirley Coast, date of birth 4/3/1987, and it says discontinue indwelling catheter. Okay, perfect. At 23:36. So right now it's about 11:15. So we're right within that 30 minutes before or after. So perfect. So I'm gonna put my hand sanitizer on, and then I'm gonna head down to Shirley's room, and then I'm gonna perform hand hygiene. I pull the curtain for privacy. Hi Shirley, how are you? Doing okay? Shirley, can I have you just verify your name and date of birth for me? Shirley Coast. Okay, 4/3/1987. And then you don't have any allergies, correct? Okay. So I've already had my CNA come in and do peri-cares and take a measure of Shirley's output. So we have that, so that's good, Shirley. So do you know what I'm gonna do today? No? Well, thankfully, you're gonna have your catheter removed. Yay! So we're gonna be doing that, okay, Shirley? Okay. So it's just gonna be a quick thing. It's just gonna take a little bit. I've had my CNA come in. We've done that. I'm just gonna ask you to like bear down, and then I'm just gonna remove it, okay? Okay, and then after I do, it's very important for you to drink a lot of fluids and urinate within 8 hours after removal, okay? I place a little hat in, okay? Okay, sounds good, Shirley. So I'm gonna to the bed. I do hand hygiene again. And I'm gonna put on my gloves. Okay. Perfect, Shirley. So I'm just gonna move that back. And then cover you up, still try and maintain some privacy for you. Okay, we're just gonna move your legs, Shirley. Okay, Shirley. So my CNA forgot to put the chucks down, so I'm just gonna be doing that, okay? Okay. Can you just lift up your butt for me? Thank you. Okay, Shirley. So I'm gonna remove your tape. Sorry if this is discomfortable. Okay. Perfect. And then I'm going to be opening up my wound lock syringe. And I'm going to be withdrawing the 5 mils I took out. Okay? So I'm just going to... Okay, so we have 5 mils exactly. Okay, so I'm gonna throw that away. Okay, Shirley, give you my garbage out. So I'm gonna rotate it slightly when I remove it, Shirley. Okay, ready? 1, 2, 3. Okay, perfect. I'm just gonna put that, and then I'm gonna fold all this up, and then I'm gonna discard of that. I'd remove my gloves, I'd perform hand hygiene, and then I'd help resituate Shirley. My CNA would come in and do peri-cares again for Shirley. I've already documented her output. And then I would restate to Shirley the importance to void before. I'd make sure her collar is up. Take off my gloves. I'd elevate the bed if need be. sure she's comfortable. How are you doing, Shirley? Good, okay. So Shirley, I'm just gonna go document how you tolerated the procedure. And then do you need anything? Okay. And then I'll leave your door shut or open? Open? Okay. So I've made Shirley's okay. I've made sure to let her know that there's a hat in. And so I'm gonna go document the procedure and clean up my workspace. Thank you.